We are now at the last plenary session of the conference. For the 2 days of this conference, we had plenaries, panel sessions, and paper presentations that focused on the work that our fellow geographers, colleagues, and friends that had done on the various forms of geographies of care. My name is Kathy Illustre, and I will be the moderator for this plenary session. And I'm actually quite excited to introduce our plenary speaker. He is Olivier Cottray, the Director for Humanitarian Solutions at Esri, the company that built the ArcGIS products. He is in charge of Esri's overall strategy for the support it provides the humanitarian sector in getting the most out of the Esri GIS solutions and for helping develop best practices in humanitarian GIS globally. Prior to joining Esri in 2020, he worked as the head of the Geneva International Center for Humanitarian Demining's Information Management Division, where he led the development and implementation of the information management system for marine action. Before this, he worked for the NGO iMMAP and for the UN Joint Logistics Center as Operations Manager and GIS Coordination and Development Officer, respectively. He started working in humanitarian GIS in 2002 when he helped found the NGO MapAction, a rapid response organization that provides immediate IMGIS support during the first few weeks following a crisis. He completed a Bachelor of Science degree in Geography and Economics at the London School of Economics in 1998, then a Master of Philosophy degree in GIS and Remote Sensing at the University of Cambridge in 1999. After graduating, he worked as a geographic data analyst and aerial photographer for the British Antarctic Survey for 3 years before joining the humanitarian community. Accompanying our speaker in the presentation is Jonathan Garrido Leca, a senior solutions engineer for the Health and Human Services Department at Esri. With more than 10 years of experience in GIS, he is leading his team's spatial analytics efforts. With a master's in GIS and a certificate in machine learning from the University of California, Riverside, he explores new possibilities to incorporate advanced analytical methods into Esri solutions for health. Further expanding on the conference theme on the geographies of care, the presentation will be on the use of ArcGIS vaccine solutions for the equitable distribution of the COVID-19 vaccine. Please welcome our plenary speaker, Mr. Olivier Cottray.
Afternoon, and thank you very much to the Philippine Geographical Society for this invitation to speak today on the topic of using spatial analysis and GIS tool to support and enhance equitable COVID vaccine distribution. My name is Olivier Cottray. I am the Director of Humanitarian Solutions at Esri, and I'm joined by my colleague, Jonathan Garrido Leca, Solutions Engineer at Esri, who will provide you with some live demos of these solutions. Now, I'll start by introducing you to a program called COVAX. You might have heard of this already, which is a program run by several international organizations to ensure equitable distribution of COVID vaccinations globally. We'll also quickly look at how the Philippines fits into that for context. We'll then look at some of the key conceptual questions that we might want to ask ourselves to ensure equitable vaccine distribution and how geographic thinking and geospatial analysis can help with this. And once we've done that, I'll hand over to my colleague Jonathan for some practical demonstrations of 3 key tools that we've put together among many others. We just made a little selection there for you. And we'll just finish off very quickly by pointing to some additional resources in case you wanted to look at these issues more closely. Now, COVAX is actually part of a larger initiative called the Access to COVID Tools Accelerator, or ACT-A. And that's a global collaboration to accelerate the development, the production, and the equitable access to COVID-19 tests, to treatments, and to vaccines. And this program was launched by the World Health Organization and partners in April 2020. And COVAX is one of the big pillars of this initiative. And it's co-led by Gavi in a procurement role mainly, by the Coalition for Epidemic Preparedness Innovations, or CEPI, in a research role, and the WHO in a normative guidance role. And its aim is to accelerate the development and manufacture specifically of COVID-19 vaccines, and to guarantee fair and equitable access for every country in the world, working on the principle essentially that no one is safe until everyone is safe. And just to point out there, as you can see, UNICEF is also part of the COVAX partnership, and it brings its vaccine distribution expertise to the table here. And underlying COVAX is the Advanced Market Commitment, the AMC, and that's an essential part of making all this happen. It's a financial mechanism that ensures that the world's poorest countries are getting access to COVID vaccines. Accompanying all this, in their normative guidance and their operational roles, WHO and UNICEF published guidance on developing a national deployment and vaccination plan for COVID-19 vaccines document. And that provides recommendations on, for example, how to segment populations into priority groups based on vulnerability and need, which is what we're going to be taking a look at later on. The specific objectives of COVAX are what you see here. So ending the acute phase of the pandemic by the end of this year, guaranteeing fair and equitable access to the vaccine, offering compelling return on investment to the development of those vaccines, to support the largest actively managed portfolio of vaccine candidates globally, and to deliver 2 billion doses by the end of 2021. And to give you an idea of the scale of this undertaking, until COVID, UNICEF's average yearly vaccine distribution amounted to about 2 billion doses. So they are effectively having to find a way of doubling their output, so to speak, over the course of a single year. So you can imagine then the value already of geographic information in better understanding the geographies that they're dealing with, both human and physical, and as well as having access to geospatial analysis tools that can allow them to design efficient supply chains. So those 2 billion doses, by the way, are meant to cover 20% of eligible countries' populations. Now, supply chain issues, especially in Q2 of 2021, mean that 2 billion target is actually now expected to be reached in the first quarter of 2022. So here you can see the eligible countries. So it's 92 low and middle income countries. You can see the Philippines highlighted here. And this is just a visual representation of this coverage globally. Now, let's just take a quick look at the situation for the Philippines for context. You can see this is from the Gavi website, the vaccine rollout site. About 10 million doses had been delivered to the Philippines at the time of publishing on that site. Now, I think that's around July, and I'm afraid it's unclear as to how many are planned over the various COVAX phases or where we are now. But if we base ourselves on this 20% of the population figure for the Philippines, that would be about 22 million people, so approximately 40 million doses to be delivered. Don't quote me on that. It's just this is just extrapolating from the numbers that you saw earlier on. But we can also look at the Philippines National COVID-19 Vaccination Dashboard. And of this week, we seem to be at just over 20% of the total population fully vaccinated. So if we do use the 10 million figure for COVAX deliveries, this stands at about 1/5 of vaccinations so far delivered through the COVAX program. And the same site, you can actually see a breakdown of these vaccinations by population groups. And we can see there, for example, a surge in vaccinations for category A4, so frontliners in essential sectors over the last couple of months. Now, this sort of population profiling and segmenting and prioritization is exactly what we'll now discuss from a geospatial perspective. Now, let's start with this premise. I am on the map, therefore I am. For COVID vaccines to be distributed equitably, it's incredibly important all populations be on the map, literally. If you're not on the map, you can be invisible to governments, to NGOs, to other health organizations. So then you can't be prioritized, you can't have resources allocated to you or be considered in access to care and service calculations, or be analyzed for other kinds of disparities that may impact your overall health and well-being. So you must be included, and to do that, of course, requires good data. Now, there are a number of sources for that. We can start with WorldPop, for example. We've got the Living Atlas, so just to name a couple there. Now, if assuming we have good population data, we can now look at how this data can be combined with other spatial data sets to support equitable COVID vaccine distribution planning. It begins by collecting and mapping existing vaccination locations like hospitals, community clinics, or pharmacies. And so again, there are a number of data sources you can consider. So as well as, for example, the Living Atlas that I mentioned earlier, you could also look at an open source data set here called healthsites.io. And once you have that, you can then specify your geographic area of interest. That can be anything from a country or a region, a city or a village, or any customized area that you're interested in. And then you have to make a determination about what is an acceptable level of access to a vaccination site. So that might be 30 minutes driving time in a city, or 15 minutes of walking time, or something else that makes sense for that specific geography. And with that information, the system calculates the percentage of the population that can adequately reach a current vaccination site. Now we need to work on filling the gaps. So adding sites in places where people don't currently have good access to the vaccine. So for this, we add in candidate vaccination sites shown here in gray. That could be parking lots for pop-up clinics. It could be schools or any other places where vaccine administration can take place. And then you could add elements of equity that go beyond just the geographic accessibility, the geographic location and proximity that we've already accounted for. We can include any and all factors that are relevant for this specific population. It could be population density, age distribution, income, access to clean water for hand hygiene, or any other indicator of vulnerability. And all those attributes are then used as a weighting factor for the last step, which is essentially to run the tool. And it selects the fewest candidate locations needed to close the geographic gaps while favoring the places with highest vulnerability. So you might say, well, that's fine for places with lots of data, but what about in places for which we don't have good data? So one of the things that is great about geography is that it gives you options to create actionable information. So here we're using an example that we set up in Uganda, where the road network in the north of the country is quite incomplete. And to supplement that data, we used readily available information like elevation and slope and land cover to calculate a level of difficulty and therefore the time that it would take to traverse various types of landscape, 1 kilometer at a time, which are represented here by the hexagons. So for example, a flat area with an impervious surface may only take 10 to 12 minutes to walk a kilometer, whereas a forested area with a steep slope would take quite a bit longer. So the point is, no matter where in the world we're working, we can get to actionable, even if it's imperfect, information. Now, before handing over to Jonathan, I just, for more of a deep dive into some of these tools, I just wanted to provide a few examples of this sort of thinking in action. So here, for example, the state of Idaho is using optimized routing and dashboards to improve the reach and efficiency of their vaccine home delivery teams. In Chile, Yo Me Vacuno, I Get Vaccinated, the dashboard tracks progress on vaccine distribution and vaccination rates. So this COVID-19 dashboard in Chile is actually regularly shared on television because it provides a way to see and share infection rates. In the UK, the National Health Service is using mapping tools to model routes to reach as many patients as possible in the least number of journeys. So travel times have been shortened, more doses are being given per day, and so the COVID-19 vaccination program is taking less time. And the Africa CDC is sharing situational awareness around the vaccine delivery, vaccine brands, and variants of concern. So all in all, a range of applications that vary from analytical tools through to communication and situational awareness tools, all of which help health authorities maximize efficiency and equity in their programs. Okay, so I'm going to hand over to Jonathan now. He will take us on a deeper dive into some of these tools, looking at how to go about locating population centers by profile, how to use GIS as a vaccine distribution scenario planner, and how to go about choosing where to add vaccine distribution sites. Over to you, Jonathan.
Thank you, Olivier. Let me go ahead and share my screen here. Okay. Can you confirm if you can see my screen?
We can see your screen, thank you.
Okay, well, before I get started, I want to emphasize that ArcGIS is a flexible platform. It can support and integrate the existing workflows from any organization or Ministry of Health. Also, this platform is open and accessible via APIs, so you can send data to and from this system if necessary. This is not a black box. Moreover, this is not an all or nothing platform. So users may like to leverage our foundational data or replicating our analytical workflows or using our app templates if they need. We let users pick and choose what they really need. So let me start with the first application. This is the Vaccination Population Estimates app. This app is based on guidance from UNICEF and the World Health Organization. And as you know, we want to ensure equitable distribution of vaccines by identifying and estimating the target populations. So the earliest phases are intended to provide the vaccine to those who need it the most. First and foremost, this includes healthcare workers and those at the highest risk for severe COVID-19 cases. In this case, identified as senior populations. Later phases could focus on at-risk populations with underlying conditions like HIV and AIDS, or people without access to clean water for hand washing. This information was gathered from Uganda's Ministry of Health and the UN Statistical Division, and we can easily replace these risk metrics with other factors that may be more relevant for a priority country. And the final phase focuses on the remainder of the general population. This is everyone else who is at lower risk for severe COVID-19. Now, this application has charts and dynamic indicators of the total population in each of these groups. Also, you can see that we have ordering estimates, assuming 975 doses of a vaccine per ordered unit. This template also assumes that the vaccine will come in 2 doses, which is the case with multiple vaccine candidates. Now, from a technical perspective, getting to this point was not a massive undertaking. We simply took every district in this region and populated them with information on the number of healthcare workers, the number of senior populations, and those with underlying health conditions. Then we added or summed them together to create these phase totals. This information can come from a number of different sources, as you can imagine. In this demo, we leverage publicly available data sources like WorldPop and annual reports from Uganda's Ministry of Health to derive the values. Now, the point is that if you have access to detailed demographic information for your area of interest or from a recent census, for example, you can integrate that information and enhance this analysis. Finally, you can use our survey tools within the platform to have each district submit values for their population variables to obtain the most accurate values. Either way, the goal is to have the most granular data available to ensure the best allocation of the vaccine and prevent gaps in coverage wherever is possible. Now, once we identify the demand, we need to create a potential distribution network for our initial phases. And for that, we are going to use the Vaccine Distribution Scenario Planner. In this application, we have taken our population layer and aggregated it into a predefined boundaries. We are using XBINs to optimize the distribution of the demand. But this app is also showing the results of our location allocation workflow. Using that workflow, we are able to identify three main things. First, we can select the main strategic facilities that can serve as distribution sites based upon the population. Second, we can estimate the population that might be served by any of these sites. This demand is illustrated by the size of these blue circles. And finally, we can identify those areas that cannot access a distribution site within 30 minutes walking time. These are highlighted in red. Now, as Olivier mentioned, there are some regions that won't have access to accurate street network data to create these right times. For those scenarios, we have two main solutions. The first one is to leverage OpenStreetMap datasets that we can digest into the platform and we can generate service areas. The second is that we can use information as elevation, slope, land cover, as Olivier also mentioned, and then we can generate walking distance areas. We used that for this demo. This application also helps users to understand the total number of served populations in blue and underserved populations in red. Finally, using the Add New Vaccine Distribution template, users are able to add an additional clinic or site to improve coverage. Here, those isolated populations are highlighted in red, and we can simulate selecting a site and placing it on the map, and we can see how much of each target population we can serve. We are living difficult times, and it is now when we must work all together. As Dr. Martin Luther King said, in the end, we will remember not the words of our enemies, but the silence of our friends. And now, Olivier is going to conclude this presentation. Back to you, Olivier.
Thanks very much for this, Jonathan. So, as promised, we just want to leave you with a few resources for further thinking and planning starting with our COVID-19 GIS hub. There you'll find a wealth of resources from data to GIS solutions like the ones that Jonathan just presented, and guidance documentation. It actually provides a really good launching pad towards many other geospatial resources for COVID-related work. So these are the links to some of the resources that I showed you earlier on. We'll make sure that these are made available to you through the event organizers. I would like to thank you for your time and for listening. And I very much look forward to the opportunity to take any questions and discuss this issue with you further now. Thank you very much for your time.
Thank you, Olivier. It is just amazing to see GIS and geospatial analysis tools in action. Such powerful tools giving way to easy to understand maps and dashboards that could produce actionable information and lead to better understanding of what is happening, and thereby can lead to improved decision making. In this case, the equitable distribution of the COVID-19 vaccine in various communities. I also appreciate how Jonathan showed a demonstration of the applications. With that, we will now proceed with the open forum. We encourage our attendees to type in your questions and comments in the Zoom chat box. Olivier, in the presentation, the focus was on the solution, particularly on the technology side. I would like to inquire if you could share with this audience a concrete example of an outcome after an organization implemented the solution. For instance, has there been any instance where it has affected or influenced vaccine distribution plans, or where to put up a distribution center for a community?
Well, thank you, Kathy. Thank you, and good afternoon, everybody. Thanks once again for this opportunity. Indeed, it's actually quite early in the process for this sort of feedback to trickle back up to the system. What I can say is that we are operating within a broader group called the COVAX GIS Coordination Group, or Working Group, in fact, which comprises WHO and UNICEF and a number of NGOs who are themselves in charge of translating these technical solutions into actual outcomes on the ground. The reports that we're getting are very positive, very encouraging. The operators are really very keen to implement these tools. They really see the value of it. And we have already seen them being applied to, let's say, overall situational awareness in a number of countries. South Sudan comes to mind just because I was discussing this just a few days ago. So we know that they're in the process of being implemented. The outcome feedback is yet to come back to us, if you like. It's still early days for that, but it's all ongoing. So very, very interesting, exciting times. Yeah.
Thank you, Olivier. We actually now have questions in the chat box, which I'll read. This one is from Jim Bagano. Are there methods and tools presented freely available for individual researchers or grassroots groups to use?
Great, thanks for this question. There are two answers to that question. From the research point of view, if this is research that's done in an academic setting, we have an education program which essentially makes our Esri tools freely available to educational facilities. And from the grassroots point of view, I'll interpret that as meaning NGOs. We have a non-profit program that makes the tools available at sort of administrative costs essentially, and really facilitates access to those tools. The other thing I should point out is that they're being deployed through this GIS working group I was telling you about, which is also involved in a lot of fundraising activities to precisely provide a context for NGOs to work within, a sort of fully funded context for NGOs to work within. So there are a number of routes, a number of answers actually to that question. But by and large, we very much want to make sure the cost does not become a barrier to implementing these solutions. So there's always a way.
Thank you, Olivier, for that. Yeah. Especially for the members or the attendees that we have. A lot of them are researchers or from NGOs, not really from big organizations, but a lot are from the academe, and maybe if the institution such as UP, the UP system now has access to these tools that you've actually shown just this year. The UP system worked with the local distributor of Esri, and faculty and students and researchers of the institution can actually access the ArcGIS platform through this program.
Right, and so if an academic institution already has an ArcGIS online environment, then it's actually a fairly simple process of transferring these solutions. The solutions themselves are come at absolutely no extra cost. They just get implemented within that environment. They're fairly quick to deploy, and then it's a case of applying the relevant data sets to them for your geography of interest, essentially. Yeah. For this, I mean, I as you just mentioned, Kathy, I mean, I very much encourage you to discuss with your distributor here in the Philippines, and we can certainly facilitate that process.
Thank you for that additional comment, Olivier. We have another question from Vanessa Joy Anacta. How do archipelagic countries fare in the vaccine distribution? In the case of the Philippines, what are your thoughts regarding logistical concerns? In the variables, did you include the type of road?
Yeah, that's a multi-part question. On the logistics aspect, well, it really depends on essentially the remoteness of some of the islands that are involved. There's been some very interesting work done by a group called We Robotics, who specialize and who've been supporting what you might know as the flying labs, which are essentially a hub of drone operators. Initially, they did this for mapping purposes, but they're now more and more getting involved in drone delivery. And they've been experimenting, and not just experimenting, they've been implementing, I think it was in Madagascar, if I'm not mistaken, and in Eastern Africa, with long distance drone delivery of vaccines. And so that is being looked at quite seriously as an option for quickly accessing long distances, remote areas without breaking the cold chain. Because of course the big issue with many of the vaccines that are being used is that some of them require very, very cold temperatures and to be maintained in very cold temperatures. So this cold chain issue becomes a real factor, and especially in archipelagos. Regarding the road types, yes, absolutely. The routing tools that are applied take into account different road types. That's up to the user to define. Different areas have different road types, different road conditions, different costs of transit across those roads, along those roads. And so, of course, the data varies according to the geography that you're working in. As you saw from the demonstration, even if you do not have data on road types, you can estimate or proxy that through various raster data sets, including land cover, elevation, aspect, slope, and provide a bit of an approximation to that. So, but absolutely, we differentiate road types, or at least travel cost in that research, in that work.
Right. Thanks for that. We have another question, this time from Lance Collins. How do we spatialize the differential lost opportunity costs experienced or expected to be experienced by local areas due to international intellectual property laws limiting local manufacture of vaccines? Is it possible to represent the differential impact of international IP law on vaccine distribution by city or province?
I think that's a very interesting question. I don't have a yes or no answer to it. I think it would be extremely valuable to research that and to see whether or not we can indeed demonstrate the differential access to vaccines. The COVAX program is precisely designed to limit that impact because it guarantees a certain amount, as I said, 20%, sufficient vaccinations for 20% of the population. Now, it's not up to me to judge if that 20% is the right figure or not, but that is precisely to avoid these differential access issues. The COVAX program was designed for this. That does not necessarily address supply issues, manufacturing issues, and supply chain issues, even though that is one of the aspects that's being looked at. And I think it's a very interesting question, and I think it's something that we'll certainly want to have a sort of a perspective look on, and you know, in order to learn for future events. Yeah, great question, but not much of an answer, I'm afraid.
I was actually going to say that we need further research to come up with an interesting answer for such an interesting question, right? And then we also have some cases where there are countries that do not really officially recognize that COVID is happening. How do these organizations that you work with take into account those countries, and how do you actually give vaccine to those countries when they're saying that it's non-existent to begin with?
There is no, you know, the sovereignty and national ownership of this process primes, and so there's no magic wand to that. We can only make the tools available, the information available as best we can. It's not something that that I know of anyway, certainly not in our position. We're just providing technical solutions and methodologies. The politics behind you know, the various incentives are complex. What I do know is that, as I said, you know, national authority, national ownership of this process has to be maintained. And one thing that I can say that's somewhat related to that is that we do work a lot with things like vaccine hesitancy. So we look at trying to map out attitudinal issues around COVID and around the vaccine itself, to try and monitor where are those pockets where there's hesitancy to the vaccine, which is often linked to, in fact, questioning of COVID itself. You know, so this sort of issue around information and awareness, and certainly being able to map those pockets allows authorities to target awareness campaigns better. But that's generally at a subnational level. When you're dealing, and your question relates to, you know, a national attitude towards that, well, that becomes something that's well above my head, to be honest.
Yeah, I suppose one of the first few steps in solving a problem is acknowledging to begin with that there is a problem, right? And, and I suppose for this one, there's really a lot of things to consider, and especially when we're talking about sovereignty and politics, it becomes something way bigger than just that one problem, right?
Yeah, I mean, just to add on that, I mean, I think there's also to take into account the impact of visibility and information. So when you start to see other countries act in a, act on their COVID problem, have success in addressing the COVID problem, that also serves to break down some of those barriers and hesitancies. So even if we don't necessarily have direct leverage on a particular country's attitude to it, we can hope that positive and success stories around in neighboring countries do have an impact on that attitude and on the openness for in dealing with it. So that's another aspect of sort of very visual information that, of course, maps and GIS provide, in fact.
Since you mentioned about vaccine hesitancy, I'm just curious now about the distribution of those population who are hesitant to get the vaccine, as opposed to those who are willing to get the vaccine, but then the vaccine is not available. And I think for the Philippines, we started with a big number of the population being hesitant to the vaccine, but we're now warming up to it. People are really lining up, but the access of the supply is not available. And then you have these other countries, on the other hand, that has massive supplies of the vaccine, but also a big amount of the population who are hesitant to get the vaccine. I was wondering if you've seen a pattern like that.
A pattern, I don't know. I think I make the same observation as you do, which just seems well, extremely unfortunate, to say the least. That you have these surpluses in some areas and these this sort of lack of supply in others. Again, COVAX is working towards smoothing that curve as much as possible. There are all sorts of other issues at play there in terms of, internal, again, national politics of where those vaccines are coming from and where they've been committed to. These are all very politicized questions. All we can do is, like I said, put out as much information as we can through our various channels, through the various tools that we have, to just show the state of play, to show where vaccines are being taken up, where they are not, where they are missing, and hope that information has an impact to, as I said, smoothen that discrepancy curve as much as possible. It's all about awareness. It's all about making getting the information out there as objectively and clearly as possible.
Thank you for that, Olivier. I don't see any other questions in the chat box. As much as what you had in your presentation, that's all the questions I have. But we have a little bit more time. And since I have you here, I just have one other question, not exactly related to the vaccine distribution, but more of your work in the humanitarian community. If you could just share some of the things that you've seen, how GIS has been used for the humanitarian community. I think a lot of the attendees would be interested to hear about that experience of yours.
Oh, for sure. Yeah, I mean, the COVAX or the COVID distribution is one aspect, and one aspect of what we call humanitarian GIS in general, which you could define as putting geospatial capabilities at the disposal of humanitarian programming, and humanitarian operations management. Now, I started in this field about 20 years ago when it was a relatively early and sort of burgeoning early discipline, and at the time, really the notion was, well, let's just make lots of maps, just make as many maps as we can, and make them available to humanitarian responders, because when an event happens, maps become obsolete, and you want to update that picture so that they can manage their operations properly. Now, over the last 20 years, this field has really developed, has really grown to go beyond just simply producing maps to really applying spatial analysis. And this is one example, right? So spatial analysis around distribution, around inequities. And we see those more and more in other fields of work as well, around food security, around other health issues. And it's been a really fascinating journey to see the development of geospatial tools for that. What we do at Esri specifically to support that process, of that sort of learning process, is that we have 4 key objectives, key areas that we really want to support in the long term, that go well beyond the actual technology, and align with, let's say, humanitarian agenda items. One key one is around localization, for example, which is really to try and decentralize and distribute the capacity in humanitarian GIS as much as possible. The traditional humanitarian model is very much a sort of top-down approach. An event happens somewhere and you bring in resources from the outside to deal with it. And we're working with the humanitarian community in this new approach of saying, well, the event has happened somewhere. How far out from that event do you need to go in order to find the resources needed to respond? And so one big area of work is in this sort of decentralization of humanitarian GIS capacity. Another one is applying GIS to risk reduction. So not just GIS to operations management after an event has occurred, but how can we apply GIS to design ways of building and ways of using land that reduce risk and vulnerability to disaster events in the first place. So there's a number of very exciting areas of work there that I'm very much hoping will just help GIS enhance the impact of the humanitarian effort. It's a very fast growing field. It was a handful of organizations 20 years ago, and now most humanitarian organizations, UN agencies, will have some sort of GIS capacity to respond. There are a number of specialist GIS organizations. We mentioned MapAction, but there's a group called iMMAP. There's the Humanitarian OpenStreetMap team, Carte ONG, and GIS Corps. A number of these NGOs that just provide GIS support to humanitarian operations, and it's a very, very dynamic field.
Thank you for that, Olivier. I hope with that piece of sharing from your experience would actually really inspire the use of GIS by our attendees now. I know a number of them are working in DRR as a research. So maybe the use of GIS, particularly ArcGIS, would be something that they would be interested to do. We have another question here by Celeste Ermida. It was mentioned that one of the things you considered is identifying and prioritizing critical populations. I'm wondering if you also considered population density, which may be a factor in the spread of the disease and can therefore add to the risk of critical populations.
Yes, absolutely. The factors that are put into these solutions really depend on the models, the sort of epidemiological models that are being taken into account. And population density is one of those factors, and it is a piece of information, and it's a variable that can be integrated into those solutions using some of the data sources that we mentioned, like WorldPop, for example, that provides already an initial sense of that. And if you've got even better localized data for that, then all the better. But that is one of those variables that can be integrated into this sort of optimization process. Yeah.
Yeah, thank you for that insight on that question about using the population density as another parameter. Right, so I think we have gone through all the questions, unless there are other questions or comments from the audience. If it's too late to type it now, we could actually have you turn on your mic and ask your question. Right.
And I'd like to really encourage anybody who would like to follow up on any of these things, please don't hesitate to reach out to me. I can't remember if my email was put on the presentation, but if anybody would like to investigate any of these things further, I'll be more than happy to discuss. So please, feel free to reach out also.
Olivier, can we put your email address in the chat box so that they would have access to it?
Yeah, no problem. Absolutely.
All
I can actually do that if you like.
Okay, thank you. All right, so I think that's about it for our open forum. Once again, thank you very much for accepting our invitation to talk in this plenary session of the ICGS, Olivier. And
Thank
to
you.
show our appreciation, the PGS would be giving a certificate to you, our plenary speaker. So this certificate of appreciation is given to Olivier Cottray as plenary speaker at the International Conference on Geographical Studies 2021, Geographies of Care, Lives, Spatialities, Experiences, and Practices, held virtually on November 5, 2021 at the College of Social Sciences and Philosophy, University of the Philippines, Diliman. Signed by the coordinators of ICGS, Bernardo Arellano III, Fernand Francis Hermoso, signed the president of the PGS, Emmanuel Garcia, and signed by the chair of the UP Department of Geography, Joseph Palis.
Well, thank you very, very much. It's been a real pleasure. Thank you for the invitation. And yeah, I look forward to hearing from anybody who'd like to discuss further, but that's very much appreciated. Thank you.